And joining us this afternoon to discuss the Biden administration's next phase of the COVID response is Dr. John Swartzberg, Professor Emeritus of Infectious Diseases and Vaccinology at UC Berkeley. Doctor, always a pleasure to see you. What do you expect to hear from President Biden tomorrow in his primetime address?
Well, I expect him to really lay out some of the necessary things that we really need to be doing and make them very clear to the American public. For example, working with the World Health Organization, working with other countries to get the world vaccinated, not just America. That's a critical issue, and he's got to be working with these organizations in these countries to accomplish that. I expect this to be a big part of his plan. Certainly, he's going to talk about making sure that we can get more people vaccinated in this country. It's really, it's just so frustrating to have a tool that works so well and to have so many people not using it. So whether it's going to be with encouraging companies to vaccinate their employees, that is mandating vaccination for employees, whether it will be making certain that all federal employees get vaccinated, I think we'll hear things about that. I hope to hear things about funding public health, long-term, robust funding, so we're prepared not only for the rest of this pandemic, but for future pandemics, to improve our hospital capacity so we never have to worry about running out of ventilators or oxygen. These are really critical things. There's some things that really are out of his control that I wish he could do. For example, knock some sense into these governors like the one from Florida and Texas who are just standing in the way and impairing people's health by their crazy policies. That would be wonderful. And also to work with the public to really try to stamp out the anti-vax movement to the extent we can, because the misinformation that's being promulgated to our population is just costing lives and misery to people.
A lot to look forward to in this presidential announcement tomorrow in regards to the next phase of how the U.S. government is going to combat COVID. Dr. President Biden's announcement will come, though, as the U.S. is facing a significant surge in COVID cases in children. The numbers were just released by the American Academy of Pediatrics and the Children's Hospital Association, and they showed that nearly 252,000 children tested positive, and that was just last week alone. How concerning is this?
Well, it's obviously very concerning. As the grandfather to an 11-year-old who isn't vaccinated, it's something that's on my mind constantly, and I'm sure it's on every family's mind. The virus is going to go to where it is easiest to infect people. And who's that? The people who aren't vaccinated are not previously infected and now immune. So the largest group of people right now are children between the ages of 1 and 18. And after in 12 to 18, we need more of those kids vaccinated, the vaccines available to them. But under 12, we can't vaccinate them yet because the vaccine hasn't been approved. So it's critical that we get the vaccine in the arms of these kids as soon as possible. But, you know, we can do a lot more. We can build safety around these children who can't be vaccinated. That is making sure that the families are vaccinated, making sure that the families aren't doing things that puts their child at risk, like traveling, for example, or sleepover parties with people who aren't being as safe. So there's a lot that families can do to protect their children beyond just the school.
It is important, though, to note, Doctor, that severe illness and deaths due to COVID-19 remains really uncommon and low among children. So something that I wanted to point out. We don't have a whole lot of time left, but I did want to get your thoughts on booster shots. The administration now delaying when they were going to try to make additional doses of some of the vaccines available to most adults, and the World Health Organization encouraging world leaders to hold off even longer. What do you make of all of this?
Well, it's a real conundrum, isn't it? I think that the question isn't if booster shots are going to be necessary. I think they will be, or at least a further jab will be necessary to complete a vaccine series is probably the best way to look at it. The question really is, when will it be necessary? And that's the question that isn't answered yet. Right now, we're seeing vaccines protect very well against hospitalization and death. Well over 95% of all the hospitalizations we see in our state are in people that are not vaccinated. So it's a question of when this will be advised to the American public to get their third in the series of vaccines. I'm not sure when that's going to happen. There's a lot of a lot of things that are standing in the way, including that we don't have as robust a data as we need right now.
Right. All right. Again, President Biden set to make a big announcement tomorrow in regards to COVID-19. We'll be carrying that live here on KTVU. Dr. John Swartzberg, thank you so much.
Thank you.